everybody, this is Tess with ROE Dental Lab, and today I want to talk with you about our variety of crown and bridge offerings. I know here at ROE we have a ton of great selections, so I want to talk about which materials you might use when and why. And don't forget, here at ROE we are a full service lab, so we do offer more than just crowns to meet your denture, partial, fixed, full arch, guard needs, you name it, we have it. Let's dive into these crown and bridge materials now. First, I want to talk about posterior restorations. We have a couple different options when it comes to monolithic zirconia as well as porcelain and metal blends. So let's dive into that a little bit. First of which is going to be our zRc, so our zirconia row crown. It's going to be our baseline everyday offering for monolithic zirconia, perfect for posterior restorations. Say you have a patient who is a heavy bruxer with kind of monochromatic colored teeth. zRc is going to be perfect for them as far as its strength and what a great basic offering it is for those heavy bruxer patients. Let's say you're restoring something in the posterior smile line, it's a first premolar, and you want something just a little bit better aesthetically than the zRc, but you want all the strength of our full zirconia offerings. We also have TLZ, which is going to be a monolithic full zirconia that we coat with an aesthetic MiYO glazing. So it's giving you all the strength of full zirconia and some of that aesthetic value that comes with that glazing. Our MiYO glazing is going to be the market-leading stain and glaze material that we utilize on our TLZ crowns. This beautiful glaze is typically used for anterior cases, but we add it to our TLZ since you can place that anterior, posterior, wherever you would like. We also have PFM and full cast metal offerings for posterior crowns. We're all very familiar with porcelain fused to metal and it being used on posterior restorations. It's great in the back, obviously, because of the metal margin. Typically, people don't really like to use that in the anterior region, but it's something we can definitely get done for you. And then we also have our full cast metal crowns. So we offer gold alloy as well as silver alloy depending on what you're looking for. Many times doctors will like to choose full cast gold metal crown if something's really subgingival posterior because gold can be known for some of its biocompatibility traits. Now let's move from the back to the front. Say you have a patient approach you that is a little bit older who has more kind of worn, flat, monochromatic teeth, but we still want to offer them something aesthetic because it is going anterior. EMAX Monolithic is going to be a great offering for this patient. It's aesthetic, it's beautiful, we all know and love the material, but not a ton of characterization. But what if you want something that's just a step up from that? I know myself, I bleach my teeth frequently, so I do have a little bit more of that characterization when it comes to the shade of my teeth. What we have for those patients is going to be our layered restorations. We offer that in two different materials. So we have a layered EMAX material, and then we also have a PFZ, porcelain fused to zirconia. And once we kind of take a look at the characterization of the teeth, we can then kind of hone in on the bite. You know, what are the needs of this patient? Is EMAX a good solution for them? Or do we need something a little bit hardier with the zirconia base? I know myself, I love to grind my teeth at night for some reason, so I would lean myself more towards PFC, but we have options for any of your patient scenarios, no matter if they're a heavy grinder, if they have a lot of shade variation, or if they just need the basic EMAX monolithic offering. We have a great selection for you that's going to suit whatever need you and your patient have. One more thing I want to note here is going to be our bridge offerings. So we know bridges, 3 or more units, can be posterior, anterior. So again, let's start with the posterior bridge offerings. We have our PFM, we have our zRc, and then if you have a bridge that is covering, let's say, 2 premolars and a molar, you may want to lean again towards that TLZ that's going to be our monolithic full zirconia offering with that aesthetic MiYO glaze. So we're getting all the strength of full zirconia, but you're still getting the aesthetic value with some of that glazing to add to the characteristic and sheen of the bridge. For our anterior bridge offerings, we have two options as far as that goes. It's going to be our Monolithic EMAX as well as our PFZ porcelain fused zirconia. Say you have an unconventional case present in your office where you know the needs are going to be outside of the realm of what's normal for your crown and bridge cases. Maybe they have calcification we're looking to mimic, staining, we're looking to copy certain contour, or maybe we just have a very specific picky patient that wants a little more involved with the process. Here at ROE, we have our Bespoke crown and bridge line, and what that is a product and a process. When it comes to shade transition, tooth morphology, shape, shade, contour, all of those finite details that go into getting these cases right. Throughout the process, you also work directly with our artists and technicians and have multiple opportunities to take a look at the case to approve the shape, the shade, the contour, to make sure that what you and your patient have in mind is exactly what you're getting back. Feel free to call into ROE directly and talk with one of our technical support specialists. And again, please don't forget, we've got all these great crown and bridge offerings, but we are a full service lab and do so much more when it comes to your needs for fixed full arch, guards, dentures, partials, you name it. Thank you so much, and we look forward to working on your next fixed case with you.